Hello, everyone. Welcome to our monthly informational webinar for bariatric surgery in Mexico. Today, I have pleasure to have as a guest Dr. Miguel Montalvo from our hospital in Mexico, Tijuana, and myself. My name is Elli, and I'm the CEO, founder of Mexico Bariatric Center. I'm joining you from our office in California, Sacramento, and we have a pleasure to have Dr. Montalvo and myself to go over our presentation. And the subject of our presentation today is collision of two pandemics, COVID-19 and obesity. Just to go over some of the detail of our raffle, if you guys have submitted a health questionnaire prior to this webinar, and so there is no need to redo it. You don't need to resubmit a health questionnaire. If you haven't done that, just go to Mexico Bariatric Center .com/health-questionnaire/ and if you do that, please select Dr. Miguel Montalvo as a surgeon of your choice and watch the webinar to the end, because that's a requirement for you to be able to participate in our $2,000 off of the surgery package raffle. Again, if you have submitted a health questionnaire before, you don't need to do that. We just switch your surgeon to Dr. Montalvo. So back to COVID-19 obesity. So obesity is a global epidemic at a pandemic proportion, and we already went through COVID for a few years now, and we still have the tail end of it. So we are, again, our presenter today, our guest is Dr. Miguel Montalvo, one of our top surgeons in Tijuana, Mexico, and myself. My name is Elli, CEO and founder of Mexico Bariatric Center. Shortly MBC. We would allow you to ask questions. Well, I mean, you can ask questions, but we would answer all the questions at the end. If you want to ask your questions, just use Q&A tab and type your question. We would answer it at the end of the presentation. We try to cover as much as we can for the questions that are generally asked. If not, so please pay attention so we don't have to answer the same repeat question. But other than that, we try to cover it at the end. The subjects that we are covering today, first and foremost, is what is obesity? What are the risks of being overweight? What are the solutions for, to get rid of our extra fat? Weight loss surgery. And then we talk about medical tourism and how Mexico Bariatric Center can help with this weight loss surgery journey. Then Dr. Montalvo takes over and talks about various options as much as we can, the time allows. And then at the end, we would go over Q&A. And at the end, for people who have submitted a health questionnaire and attended the webinar all the way, we will give them a chance to be in a raffle of $2,000 off of the surgery package. So obesity is a chronic disease that is a global problem. Basically, our bodies are not used to processed food, sugary drinks, and the calories that are available to us, fast food, is not something our body is used to. On top of that, physical activity is so rare. We all just jump in our cars and drive where you want to go, and you just park in your garage and you go home, and there is no walking or any physical activity on a day-to-day basis. So our body doesn't have any defense mechanism against all these variables that we are exposed to. Of course, you know, our genetics is a big portion of how we respond to food, and how the environment is huge, how we were brought up in our developmental history. These are all factors. But in general, you know, increased nutrient content of food, lack of physical activity, stress. You know, when we are stressed, we eat. When we're tired, we eat to get energy so we can get going. You know, not getting enough sleep. Of course, some of the drugs that are making us gain weight. These are all factors. So just a quick overview of, you know, basically we have what we call fat cells, right? So adipose tissues are made of fat cells. And when we gain weight, not only the number of fat cells increase, also the structure of the fat cells change. On my right side of my screen, we see fat cells and adipose tissue of a lean person on the top versus, obese person on the top versus the one on a lean person on the bottom. You see the size, the structure is changed. And as a result of these changes, your body doesn't respond to insulin. That's why the diabetes type 2, you get diabetes type 2. Your body doesn't respond to leptin. So we keep eating and we don't feel satisfied yet. Even to vaccination, your body responds less effective to vaccination and therapies. So that's why the COVID breakthrough was a wake-up call for us to know, you know, we knew like obesity comes with heart problem and diabetes type 2 and all that, but then COVID kind of made this to be more of a issue and brought to our attention that we do need to lose weight. We need to live a healthy life. And if we don't, we are exposing ourselves to viruses like COVID and all the other comorbidities that comes with obesity. Basically, the formula that determines where you are in this chart is called BMI, which is body mass index, is a very simple formula where you put your height and weight and it gives you a number. If your number is below 25, you consider normal. 25 to 30, you're still normal, but you're getting into overweight. And then after that, you be obese, and then we become morbidly obese when we are even out over 40 BMI. Of course, you know, your bone structure, your shape is very important as well, but this is just a generic number that tells you where you are in this chart. We talked about epidemic, pandemic, so 40% of US adults are struggling with obesity. And like we said, it has major risk factors. This is animation. If I can make it work, I like it because it shows what happens when we gain weight.
Consider this. Our diaphragm is one of the major muscles that helps with breathing. Breathe in and the diaphragm contracts and the lungs expand to take in oxygen. But if you're obese, fat in the abdomen can push on the diaphragm, limiting how much air you take in.
So that's very simple. You know, it affects everything. Your breathing. So I'm going to go back here, sorry. So we talked about heart disease, stroke, lung disease, diabetes, impaired immune system, inflammation, blood clots. And in the case of COVID viruses were attaching themselves to the fat cells. And so if you have more fat cells, you have more breeding ground for infection. And that's all as simple as it was. With COVID, this is an international number survey of different countries, different hospitals, 113% more likely if you have obesity problem to need a medical care in a hospital. 74% more likely that we can end up in ICU if you have obesity. And if we are obese, we are 48% more likely to die because of COVID. Of course, the pandemic itself, the shutdowns didn't help. We just probably caused more weight gain. And now we get to a point that we say, okay, so what's the cure for obesity? Diet, exercise, medication. To this point, there is no data that shows diet, exercise, and medication is a long-term solution to get rid of obesity. Of course, this is not for everyone, but in general, there is no long-term solution. However, bariatrics or weight loss surgery is a fast, safe, and a long-term solution. So you ask, so what is it that bariatric surgery do to make this happen? Basically, once they change your anatomy, they cut your stomach, they reroute your intestine. So once we do that, your brain interaction with your gut hormones and your hormones in general changes. And this illustration on my right side of my screen is a good way of saying what happens when you do exercise and what happens when you get bariatric surgery. So a person who is 250 pounds, their brain, their hormones, the interaction between their brain and hormones, the metabolic system is set at 250. They're used to that weight. If they go through extreme diet and exercise, and we're talking about exercise like a boot camp type of exercise, your weight goes down 75 pounds, but your brain and your hormones and your body's thermostat, your metabolic system is used to that 250. So what is it going to do is trying to eat more, doesn't burn the fat to save it, so to get you back to where you were at 250. That's why it's hard to diet. first 2 weeks, it works. And then after that, your body is resisting, wants to get you back to where you were. Now, when you do bariatric surgery, the minute they do the operation, you wake up, all of a sudden your metabolic system is changed. Your brain all of a sudden is interacting with your hormones, and it see you at 175 pounds. So at that point, what's going to happen is you don't get hungry, you don't want to eat as much, and your fat, your metabolism goes up, so it burns your fat. So you don't eat as much, and you get slim quickly. That's what happens with weight loss surgery. Now, people who have insurance or don't have insurance, or their insurance gives them very tough requirements to undergo bariatric surgery, can take advantage of what we call medical tourism. So medical tourism is basically going to a different location across the border to get affordable but reliable treatment. Not all medical tourism companies are the same. You just have to do your research. Mexico Bariatric Center is one of the leading providers of bariatric and metabolic surgery right now. And we are a US-based corporation. Our main office in Sacramento. And our mission since our inception 10 years ago. So this company is 10 years old right now. Of course, myself, I've been in the medical tourism industry since 2007. But MBC was formed 2012. So this year is our 10th year anniversary. And since inception, our goal has been provide the highest quality medical care at affordable prices. So 10 years in medical tourism, 18,000 plus successful surgeries performed. And right now we're working with top 7 exclusive surgeons in Mexico, in Tijuana and Guadalajara. We don't give you runaround. Basically, our process is 1, 2, 3. You fill out the health questionnaire. We get your approval for the best option, surgery option for you. You pick a date, you pay the deposit, you book your flight, you do the paperwork, do the pre-op diet, and you are on your way to get a new life. What the patients call to be on a loser's bench. We offer all-inclusive packages that basically cover surgeon fee, hospital fee, hotel fee, pre-op, post-op diets, medications, nutrition support, aftercare, and of course, transportation. And you may ask, what's a good time? A good time is today. You need to get this life-changing procedure. If you haven't been successful losing weight with diet and exercise, to get to a prolonged life in a very quality life, and you may as well decide to do it today. So, you know, we went through pandemic. It made us actually stronger because, you know, we learned how to deal with viruses. We learned how to test what's the best way to approach, and it just made us stronger. So basically, you are driving or flying, most of the people fly to San Diego International Airport. By the way, they're just making some construction in the airport, the San Diego International Airport, but there's nothing to worry about. So you arrive before noon for us to have enough time to do all the tests that we have to do. And your departure should be around 1 to 2 p.m. for best timing, so you don't wait too long at the airport. And we have enough time to cross you from the border. As I mentioned, we have an exclusive network of best bariatric surgeons in Mexico. Dr. Miguel Montalvo, that is present as a guest today. Dr. Louisiana Valenzuela, our chief surgeon. Dr. Alejandro Gutierrez, Rodriguez Lopez, Jacqueline Usana. Dr. Usana is working in Tijuana as well as Guadalajara, and Dr. Jesus Ceja. So working with 7 top surgeons gives us the option, the freedom to give you pretty much any type of surgery that is best for you. We're not limited to 1 type or 2 types of surgery, or we're not limited to if you need a bypass and your bypass, if your BMI is, let's say, 55, we can still do it. All the revisional surgeries, we can do it. And what you get is we have a surgeon liaison, a bilingual doctor that is sitting between you and all these surgeons. And they all offer a little different services. So we have overlap, but then we also have a wide spectrum, wide range of procedures that we can offer that almost no other company is capable to do. You have 7 qualified surgeons in one place. And you have the surgeon liaison to look over your health history with these surgeons. You want to make sure you get what is best for you. We work in a hospital that has been doing exclusive bariatric procedures for at least 12 years. We use mainly we use Hyatt Place in Tijuana, but we also use Fairfield, Marriott. On the day that you arrive, you basically do the pre-op test. We take you to the hotel so you can get a good night's rest and be relaxed. So tomorrow you can go to the hospital and get the procedures. On the day of the surgery, our staff going to pick you up, take you to the hospital. They'll tell you what time to show up in the lobby, so no worries. You pretty much stay about 2 days for sleeve, 3 days for bypass or DS, and 1 day for endoscopic procedures like ESG and balloon. We do all the tests, and basically you're ready to fly back home. We bring you back to San Diego. You drive or fly back home. We do have a sophisticated system that we have developed over years. As I mentioned, surgeon liaison is one of the components of this system, but we also do surgeons' load management. So we make sure our surgeons are on a daily basis. They're not overloaded. And that's why our complication rate has been consistently, since the beginning, has been less than 0.5%. This is less than 1%. And those are complications more like wound infection or some kind of bleeding, but nothing that is a, death or any problem risks like that. Of course, if you consider the complexity of the procedures that we do with this number, this is huge for low complications. So this chart shows that a lot of people, general public try to do diet and exercise. Some try to go through medication and pharmacotherapy. And then it comes in the endoscopic procedures like a gastric balloon and ESG, which is endo sleeve. And then we get to a smaller proportion, which is bariatric surgery, which is gastric sleeve, gastric bypass, duodenal switch, mini sleeve. Look at all the options that you have with us. Of course, gastric band is pretty much outdated. We do VSG, mini gastric sleeve, single incision gastric sleeve, R&Y gastric bypass, mini bypass, regular traditional DS, duodenal switch. We do SADI, all the different revision from VBG to bypass, from sleeve to bypass, band to sleeve. And we even, if we have to reverse a bypass, if patients have had malnutrition problem, we do even a reversal of a bypass. So these are all laparoscopic procedures. And look at the range. And I'm going to, so that's not detail enough, because let's say, for example, for sleep, we could do a BMI of pretty much 29 to 92. So there is no limit for us. For a bypass, we could do, well, usually bypass, you don't want to be lower than 35. So we could do 35 to 65. So you ask me, so what's the advantage of this? Oh, let me explain all the endo procedures too. So we do gastric balloon, we do spats and Orbera, and we do endo sleeve, which I mentioned is endoscopic sleeve gastrectomy, which is ESG. We do a revision of a bypass again with endoscopically. So you ask me, what's the advantage? Okay, so you go to a center which has maybe 1 or 2 or 3 doctors, and they can do bypass, but they're limited to a BMI of 45. And you really need to get bypass. So what happens if you go to them and say, oh, you don't need bypass, we just give you sleep? Because they can't do your BMI of 55 or 60 on a bypass. So what you end up getting is not what you need. It's like if I go to a store and I'm extra large and I go to the store and they only have a medium jacket and they say, well, hey, we're just gonna give you this medium jacket, just fit yourself in there. And remember, we always talk about, how plastic surgery is so important. Yes, if they give you plastic surgery, they give you tummy tuck and the stitches are not well done or one side is asymmetric. Yeah, it would look bad, but you still have had the tummy tuck. When they give you the wrong procedure, now your body, your internal, is not accommodating to what you got. So it's even worse. You You're getting a surgery, you're getting something in your stomach done that is not good for you. You may not lose weight, you may have to come back getting another revision. So or let's say, I see that a lot. In the United States, if you go to a endoscopic place, all they can offer is balloon. They give you balloon, but that's not what you really need. Actually, one of our patient coordinators that had this experience finally came to us and had a sleeve. That's what happened to her. So they charge you $8,000, $9,000, $10,000, give you a balloon because that's all they can do. And you come back and you don't lose the weight because that's not what you needed. So for us, we don't have to sell you anything because we can offer you whatever procedure is best for you. And if it's balloon, we give you a balloon. If it's a sleeve, we give you a sleeve. If it's endo sleeve, we give you endo sleeve. If it's a bypass, we give you bypass. If it's a DS, we give you DS. We don't have to give you something that you don't need. So yeah, you know, a lot of people fit into this BMI of 35 to 45 sleeve, so they're fine. But going with us has so many advantages, and this is the best and most important factor that you want to consider. Go to a center that they're not limited to one type of surgery. So this basically shows like what are the age. Age is another thing, you know, not every surgeon can do maybe over 62. On a limited basis, we take older patients. So, so let's get down to Dr. Montalvo and introduce him and let him take over to tell you what options we have. He's been with us for what, 4 years now? Time flies on. How many years have you been with us, Dr. Montalvo? Maybe 3 years, yeah. So, but he is an experienced surgeon. He was working with other companies, so he has a spectacular resume. He's a board certified surgeon in Mexico, and he is awesome doing gastric sleeve surgeries. I'm gonna let him talk about himself and take over from here and explain all different procedures. Thank you.
All right, let's talk about the surgeries that we offer. The gastric sleeve is the most common procedure worldwide. In this kind of procedure, we remove like the 80 or the 85% of the stomach. So most patients ask how we measure this size of the stomach we're going to remove. We put a boogie. It's a tube we're going to put inside your stomach. It's a 36 French, and then we're going to remove the rest of the stomach. So approximately it's like the 80-85% of the stomach that we're going to remove. We use to 1 to 5 tiny incisions of 5 millimeters each. Only one of 10 millimeters where we take out the stomach we're going to remove. This procedure is a restrictive procedure. It means that you're going to eat less portions, but you're going to absorb all the nutrients. So in this type of this kind of procedure, in the stomach that we remove, there goes an hormone, the ghrelin hormone, that causes the hunger and satiety. What to expect? What are the expectations with the gastric sleeve? Is the high amount of excess weight loss. Remove the portion of the stomach where ghrelin hormone is. Hold less food and decrease the food intake. It means that you're going to eat more frequently, but less portions, because you're going to have more satiety, more frequent, and it's a minimum invasive surgery. It's a laparoscopic surgery. The price can be easily revised if you need it. You're going to lose the weight that you want, okay? The most important here, once you have the surgery, is to continue with a nutriologist and make some kind of activity so you can continue after 2 years losing more weight. It's comparable, the weight loss, to a gastric bypass. There's no changes in the anatomy, and it's less the malabsorption because it's only a restrictive surgery. You're going to eat less. That's the difference with a bypass. The bypass is a malabsorptive procedure. You're not going to absorb all the nutrients. The gastric sleeve is here in the right side. It shows you're going to be like the 15-20% of your stomach, but we don't touch the rest of your transit or the intestinal, the gut or the small intestine. So you're going to be your stomach. You're going to have more satiety more fast. Next. Okay, in the endoscopic gastric sleeve surgery, this is a smaller stomach we perform, holding the stomach to create a banana-shaped tube by an endoscopic. Here we put a tube inside your mouth and go through your stomach, and we suture inside your stomach. Is this like the same principle of the surgery? The process can be reversible on certain conditions. Is reduced complication rate, no incisions, removing tissues, or is a shorter recovery. The potential risk is partial opening of the stomach pouch and ulcers. The duration is approximately 30 minutes, 45 minutes, 1 hospital night, and recovery 1 to 3 weeks. And the average of weight loss is like 40% at 1 year. And next, please. On the RNY is a gastric bypass. The RNY was the first gold standard, or the oldest procedure for weight loss. Was the first surgery for weight loss. We make a new stomach. We cut your stomach and make a pouch, while the remaining stomach stay in the place. The small intestines are rerouted to a bypass. We connect the small intestine on the pouch, and the food digestion will create malabsorption and reduce the calorie intake. So you're not going to absorb all the nutrients. And in this kind of patients, it's more important to have a good control at home with your physician, because you will need your blood test, to take your vitamins, your proteins. The excess of weight loss is comparable with the sleeve. The new stomach formed to reduce hunger and limit stomach capacity result the diabetes, hypertension, arthritis, cholesterol, like the gastric sleeve. And this procedure is the best option for patients who have bad reflux, bad GERD, or who has previous surgery for the reflux. This is known as the gold standard of bariatrics. It's improved obesity-related comorbidities like diabetes, hypertension, blood pressure, and sleep apnea, like the others, and it has a high success rate. The cons is a change of vomit and dumping syndromes and high risk of ulcers. This will depend of how previous medical issues you have. So we or at least me, I only do the RNY on select patients, not in all patients. If you don't have the indications for RNY, it will depend. That's why we always check the IHQs, okay? And we will recommend you the best. We will be the best option for you on surgery. The duration on the RNY is at like 2 hours and 3 hospital nights. The recovery will be 2 to 4 weeks. All right, what is the best surgery for me? Like I already tell you, it will depend of your HQ, your medical issues. The sleep will be the select patients with over 30 BMI and the gastric bypass 35 to 55 of BMI. Abdominal scar tissue and the gastric bypass on if the patients have acid reflux or GERD will be the best option. All right. Previous ulcer on the gastric sleeve and the bypass slower metabolisms. The gastric sleeve is a best option if you will need a revision surgery in the future. Why? Because we can convert the restrictive surgery for a malabsorptive surgery. On the sleeve, we can cut the sleeve and make a pouch and make the connection on the small bowel to convert the sleeve to a RNY or a mini bypass, and you can continue to losing more weight. On the sleeve, we don't alter the anatomy. Only we remove only the stomach, like the 80%. This is the difference with the bypass, that we need to make a pouch, a small gastric pouch, that we leave like the 10-15% of the stomach in that pouch, and make some connections with the small bowel. And then obviously the anatomy, it will be more altered, and it will be if you need a revision in the future, it can be a little more risk with this kind of surgery. Next, please. So the gastric sleeve versus the gastric bypass. Like I already said, it will be depend with a procedure choose or we will recommend for you. The expect weight loss in both of them is the same. But obviously, if you have a previous sleeve, a weight loss surgery like the sleeve, and you want to convert, or you want to continue losing weight, the best will be to convert the sleeve to a bypass, and it will be more easy to make a revision from a sleeve than make a revision of the bypass, because you already have restrictive and malabsorptive procedure with the gastric bypass. And in both of them is the comorbidities reduced. The mini bypass, the weight loss on mini bypass comparable with the RNY is the same, because the connection we do for the weight loss is the same. The only variation is the second connection we do on the small bowel for people with severe reflux. So the bile acid or the liquid fluid don't go through the stomach, and the patient can continue with the GERD, with the severe GERD or the reflux. In the mini bypass, we exclude like approximately like 2 meters of the small bowel and make the connection on the gastric pouch. So it's called the mini bypass, or the one connection bypass, or one anastomosis. This reduces the feeling of hunger through the outer gut. The pouch will hold only 4 to 6 ounces of food, and resolve, like the other procedures, the comorbidities like diabetes, hypertension, cholesterol, arthritis, patients with polycystic PCOS. In this take early society or feeling of full after a small portions. Single anastomosis or connection, only one, is safe, effective, shorter procedure than standard RNY, because obviously here in the mini bypass, we only do one connection compared with the 2 connections on the RNY. Obviously, this will be less risk, shorter procedure, shorter time at the OR, and is one of the most effective surgeries to reverse failed gastric sleeve or lap band. Obviously, the chance of vomit or dumping syndrome is there, like the RNY, and risk of ulcers of change of bile reflux, like I already told you. The duration is approximately like 2 hours and 3 nights of hospital, and the recovery will be like 2 to 4 weeks. It'll depend on each patient. Next. All right. The best surgery for the patient, comparing the gastric bypass or the RNY between the mini bypass. BMI, the BMI is the same, the marginal ulcerations in both of them. And in the mini bypass, it can be, if you suffer from reflux, severe reflux or severe GERD, it can be still present if the surgeon make a mini bypass or the sleeve. That's why in this kind of patients, the RNY will be the best option. The bypass and the mini bypass, both of them, the comorbidities will disappear or be in at least like the 90% of the patients, or they will be no more take pills for diabetes, hypertension, cholesterol, PCOS. The nutritional deficiency will be present in both of them. That's why it's very important to go with your physician at home to make the labs, the blood labs, so they can check you frequently about the vitamins, the nutrients, your blood levels, and all that. And still need to go with the nutritionist and make some kind of exercise to have the 100% of success. Next. Okay, talking about the duodenal switch. The duodenal switch is one of the the version with duodenal switch, or the patient in this kind of surgeries. Obviously, it is one of the biggest surgeries. Have a little more risk talking about RNY or sleeve, because in this kind of surgery we need to make more connections. The patient lose between the 50 and 80% of the weight loss of success weight. The high percent of duodenal switch patient with type 2 diabetes are cured after the surgery, and the malnutrition is a problem in this kind of procedure, and vitamins must be take after the surgery. Will be a very good nutritional control. The process up 80% of excess weight loss in the first year. The stomach is reduced and highest metabolic effect. And the cons is extremely strict vitamins required for life and higher risk than other bariatric procedures, because as you see in this picture, we need to make more connections. It will take obviously more time of OR. It's only for select patients. We will see it that at your HQs, and the duration is approximately 3 or 4 hours, and the hospital nights is 3 nights. And the recovery will depend on each patient from 3 to 6 weeks. Next. Okay, so we at the hospital, we use accredited facilities. Our teams are standard infection protocols, screening of patients and staff, CT scan, and COVID-19 test. We have an antibacterial station available, and fully compliant and protective preventive measures. And right now, obviously, at every hospital, we do not currently have visitations. This is a worldwide. Obviously, we have to bring or wear some masks. We practice the social distancing, test prior travel, and the vaccinations. How fast can the patient return to work after bariatric surgery? It will depend of what kind of activity you do at work. If your work is at office, you can go back from 1 to 3 weeks. It will depend too of what kind of procedure. If you be more walking or standing, we're talking about 2 or 3 weeks, fast pace, 2 to 4 weeks, and lifting. We recommend no lifting until the 4th week, and it will depend how many pounds you use at work.
Okay, well, I appreciate so much you going over these options. I was kind of answering the ones that I could type on the question and answers, but quickly, let's go over financing. If you need financing, our packages are extremely affordable, especially, you know, with the, you know, with today's value of money, we charge close to $4,000 to $5,000 for gastric sleeve. So that is extremely affordable. That's all inclusive packages. We've tried to keep our prices the same to help, you know, with all the inflation, and we still try to do the best we can and provide the best services and not cut corners and keep the prices the same. But if you do need financing, we have several options on our website. The first one, it's pretty much a personal loan, is a portal that connects you with Lending Point, some banks like Chase or Bank of America. So that's a great option. They're quick. They send you the money. You can send it to us. We also work with United Medical Credit. That's a really good company as well. They're quick to respond, very good customer service. But you see all these options on our financing page, Mexico Bariatric Center, and go to financing. Okay, so we're getting to Q&A part. So first thing I want to answer that we didn't touch on our presentation was companion. So when the pandemic happened, for several reasons, one was because our hospital is certified by the federal government, we have to follow federal government of Mexico's guidelines. One of the guidelines was no companion in the hospital. So therefore, we kept the companion in the hotel when the patient was in the hospital. We're still doing the same. This has been a great option because it doesn't expose our staff, the patient, their companion, hospital staff to extra risk of, you know, getting infected with COVID. We do so the way it works is you come with your companion the first night, you stay in the hotel together, you go to the hospital, companion stays there, but we also bring your companion to make visitation when you are up and running. Remember that at the beginning, you be kind of little drowsy and not quite, you know, awake. So after you're good to go, when you're walking, we actually recommend that you keep walking as much as you can to get all the gases out and recover faster. So once you do that, we get the companion come in the afternoon and visit with you, but they go back to the hotel. So this has been our, this is our latest protocol, which is working very good. You still have your family member, you still have your friend, companion, but they're not constantly going in and in the hospital to create a possibility of contamination. As far as the pre-op and post-op diet, once you sign up, once you make the deposit and you get on the calendar, we send you the pre-op and post-op diet. The pre-op diet depends on your BMI. If your BMI is close to 30, you only need to do a 2-day clear liquid pre-op diet. And then it goes from there. Depends on your BMI. It could be 2 weeks, 1 week, 3 weeks, if you're really high BMI. And you want to do as good of a job as you can. And protein drinks is one of them. So you want to have low calorie, high protein diet, low sugar, low carb. And the better job you do on your pre-op, it's easier, the surgery is easier on you and is easier on the surgeon. As far as, okay, so Dr. Montalvo, can you kind of go over the procedure from start to end? How does it look like when you do a gastric sleeve? But meanwhile, let me find out, because we do have a video. I'm just gonna have to find it so I can show it while you're explaining.
Okay, of course.
Let me go to our sleep page. I
Yeah,
believe
I will wait to the video.
there was a procedure here, a video here somewhere. By the way, our website is extensive. It has a lot of the material that you want to read, and we have blog posts. We pretty much cover a lot of the in and out of surgeries and how it's done. So some of the time, if you do a good job on diet and your BMI is low, it's possible that they do a 3 incision instead of 5 or 4 or 5 or 6. So that's how it works. Let me see. And these are pretty much the steps that the surgeon takes. Oh, there we go. I think that's the one. Let me see.
Obesity is a chronic disease that poses real dangers to an individual's health and longevity. Bariatric surgery has grown into one of the most popular and effective methods to combat obesity and jumpstart a healthier life. Food travels through the esophagus to the stomach, where it mixes with digestive juices, which then goes through the pyloric valve to the intestines. Mexico Bariatric Center surgical teams perform the reinforced gastric sleeve. It's done laparoscopically through 1 to 5 tiny incisions. The surgeon removes 80% of the stomach, and the remaining banana-shaped sleeve is stapled with titanium staples. For safety of the gastric sleeve, the staple line is then reinforced with sutures. This restricts the amount of food that you can eat and reduces hunger, which promotes quick and long-term weight loss. Contact our bariatric surgery experts to take the first step towards your new life.
Okay, so I'm gonna let you now do explain how it's actually done.
All right, like the video shows, this video is very good. We put a boogie inside your stomach. We remove the 80%. The boogie size is like a 36 French boogie size, and we remove approximately is like the 85% of the stomach. We cut it with a special stapler, and when we remove the stomach, we suture that staple line. The suture is to prevent that it can be a leak or a bleeding after the surgery. That's important to make a suture after once we take out the stomach and make the stapler. After we remove the stomach, we make during the surgery a leak test with a blue liquid, and then we show that there's no leaks or any other problem, and then we remove the trackers, and that's it. It will take like 1 hour making the sleeve.
Okay, I appreciate it. Thank you so much.
And the other thing, very important, you already mentioned, is to make a very good pre-op diet, because that will depend of how many incisions we will use. Like previous video or the pictures, there we can sometimes we can do only 1 incision or 3 incisions. It will depend, but that's why it's very important to make a very good pre-op diet. So the pre-op diet is to prepare your body for surgery.
Okay, so in general, I want to explain that whether you get gastric sleeve, endo, laparoscopic procedure, whatever procedure you're getting, of course, you know, gastric sleeve bypass are much more effective because it changes your metabolic system. And we saw, you know, how the surgery changes your brain, it changes your hormone and the interaction between the two. But in general, whatever procedure you get, remember, this is a tool that you are acquiring to help you lose weight. It's very effective, but you still have to use your tool to reach your goal. And like they call, for example, gastric sleeve, they call them smart procedure because when they remove portion of your stomach, let's say Dr. Montalvo mentioned 85% of your stomach, this is 85% of your stomach. So if you do the diet, pre-op diet, post-op diet, you do eat well, you be active, you be getting to your ideal weight, your goal weight. And we see this over and over. I mean, we see patients that actually, there's some of our coordinators that are working with us right now, we see that they have lost all the weight that they wanted. There's no limit. If it was 110 pounds, they've lost 110 pounds. If they needed to lose 60 pounds. So all the numbers you see, like what is the expected weight loss? Really, you can get to your goal weight. Now there is that 5% maybe that because of genetics, because of their lifestyle, because of the medication they take, however, or age, they could be that it happens that they don't get quite to their goal weight. And that's why we do the revision surgeries. When we talked about previous surgery, that's what we meant. So that's why Dr. Montalvo was explaining, if you can go with the sleeve, go with the sleeve because you have a chance to revise it to a bypass. If you go to a bypass and you don't get to your goal weight, it'd be much harder to revise a bypass. And the reason you want to do a reversal, so there is a revision surgery, which you modify, you convert your surgery to another thing. Let's say all the lap bands. So the lap band was supposed to be a reversible surgery, but it turned out that is not long-term, and also you could actually die from a lap band. So because it's an external device, they put it on your esophagus or top of your stomach, it can grow to your stomach. And if you remove it, you're gonna leak and you can die. So much for reversibility, right? But we do take lap band and convert it to sleeve. So that's a revision. Reversal is when you, let's say, some people, it happens very, very rare that you get a bypass patient that lost too much weight or they have a nutritional problem, they have to reverse it. That's a reversal. So, for example, gastric balloon is supposed to be like 100% reversible. But even ESG is not completely 100%, depends on how long it's been there. It may not be 100% reversible. So that's why it's important to get the right surgery the first time. And as we talked about. So, okay, so another question I mentioned about leptin. Dr. Montalvo, they are asking, what is leptin? And how is it different when you get bariatric surgery?
Okay, yeah, the leptin is an hormone related with the fatty tissue, and is related to the hunger. Is related with your
satiety, right? Satiety.
Yeah, obviously this will change when you have a bariatric procedure, because obviously all your body will have a change in this kind of hormones, like the ghrelin, like the leptin, like the insulin, like the thyroid, all that, the estrogens. It will be a change. So that's why, like Ron already told you, the first surgery will be the most important. So that's why when we check your issue, we make a suggest that what kind of surgery will be the best for you. So if you can make a good research about all the procedures, so you can make the best choice for you.
Okay, so I'm just typing this. Okay, so let's see what other, we already answered that. Again, they keep asking, what's the best procedure for me? So we tried to go over all the different procedures as much as we could, and Dr. Montalvo explained, what's the difference between sleeve and a bypass, mini bypass and a bypass. But there's so much information on our website or on, you can watch on Google, on the internet. But when it comes down to it, the health history, your HQ, remember that, let me go back to where it was here. Remember this? This is where it's at. You ask, why go with MBC? This is why you go with MBC. Because this surgeon liaison sitting here, and she knows which surgeon is doing what. For example, we have a surgeon that for certain condition, she takes a BMI of 29. Depends on your health history again. But maybe some other surgeons don't accept that. There is a surgeon that can do all the older ones. There's a surgeon that can do BMI of 59 bypass, or they can do endo procedures. So the surgeon liaison is going to match you with the best option, best surgeon we have for your situation. And remember, if you sign up for a procedure and you go down to Mexico, they're still going to talk to you. It's not like, oh, this patient is signed up for sleeve, so let's do this sleeve. They talk to you before the surgery and make sure you are comfortable with what you're getting. And if you have to suture, there are so many times happen, like Dr. Montalvo talks to the patient and they are a bypass patient, but then he doesn't see a reason for them to get bypassed and he signs them up for a sleeve. So that's what you get. Of course, if you paid extra, we refund you. There's no problem. So we are not limited to one type of procedure or two. So we are going to do the best option for you. I know, for example, in the United States, they're comfortable with bypass. Kaiser is trying to give everybody a bypass. But do you really need a bypass? If you don't have any problem with ulcer and stuff like that, why would you get a bypass? Why would you change the malabsorption part of your anatomy? So this is what we do. Remember this graph. So we work like this. And that's why MDC is number one, because we work with protocols. We've been working like that for years. Our surgeon liaison has been with us for 8 years. She's bilingual. She studied actually her medical degree in one of the best schools in Guadalajara. And she's an American medical doctor that is day and night is looking over every HQ. And then the surgeon takes time to review your HQ. Okay, so one of the things we talked about, the hotels that we use give you broth and gel, so you don't have to bring anything before and after surgery. We use Me Doctor Hospital at this time. Again, these people are professional, and one of the best places you can actually get bariatrics, because that's what they do. They do bariatrics all day, every day. But however, we are hopefully having a new center opening by December, maybe January, which is, again, you know, when we get there, we worry about it. But at this time, we're working in Me Doctor Hospital. Okay, so Dr. Montalvo, please talk about hernia repair, what you do when you do the surgery, and what is it that you do if you find a hernia repair required?
All right. Yes, this is a very often issue. In all patients, when I get in at the abdominal cavity, it's very obvious if there is an internal hernia. And sometimes patients don't have any symptoms. So the important to repair it is to prevent that your stomach go through the thorax. That hernia is a hiatal hernia. So the hiatal hernia is a hole on the diaphragm. So the diaphragm, like you show at the when we start this meeting, is a muscle that helps us with the breathing. So and it divides the thorax from the abdominal cavity. So if there is a hole there called hiatal hernia, the importance of this to repair it is to prevent that your new stomach go through the thorax. And the other thing is that to prevent that you continue or you can present in a future reflux. So it's very important in all patients to repair it. And to close, we need to put some stitches over there to close that and to put your stomach down in your abdominal cavity. And because if the surgeon don't repair it or don't see that important thing, it can be an emergency in the future, because as you see in the right side of the picture, your stomach can go through the thorax, and that can be an emergency.
So yeah, so actually our surgeons take time to see if you do need a hernia repair, and they fix it during the surgery. And then if it is for minimal, I don't know if it's like a few $100s, we charge you because it was extra work. Okay, so maybe you want to touch base on sleeve revision. Is it possible to do a re-sleeve, which means modify a sleeve to another sleeve?
Okay, well, that procedure exists, but at least talking about me, I don't recommend it, or I don't do it to my patients. Because why? You already have a restricted procedure. You already have a gastric sleeve. So making or taking a little more stomach, or may put another stapler over that stomach, it will be a good result, because the restrictive procedure, you already have it. In that case, the option that you have for continue with your weight loss or have more success will be to convert that restrictive procedure to a malabsorptive procedure. Indeed, in this case, will be a mini bypass or a RNY. It will depend the case, okay? Because it depends on each patient. Because if you have some severe reflux, you have some problems with your esophagus, you have previous gastric ulcers, we have a lot of things. It will depend what we suggest to do a mini bypass, RNY, duodenal switch, or other of the options that we have.
Oh, okay. So we mentioned about wearing masks and social distancing. We don't require COVID vaccination. When you go back, depends on which country you go to or where you fly back to, you may need show COVID vaccination or a PCR test. If you do need a PCR test, we could do it for you on a 12-hour basis before you depart. So, but we don't require vaccination. Also, we do highly recommend that you do a test, even if it's an in-home test. Do the test before you depart. For yourself, your companion, it's just a safe thing to do to know, first of all, if you got it or not, and then also is courteous to other people, because you're going to go in the airport, you're going to go to the flight, and you won't expose anybody to it. That's a good question. They're asking, if your acid reflux is due to obesity, then you'd be okay to do sleeve and not bypass, correct?
The reflux or the GERD have a lot of factors. One of the factors, and more frequently, is the hiatal hernia. But the GERD or the reflux is related to other factors, like the overweight, like the kind of diet you follow. If you have, this is a birth defect. But it will have a lot of size. It can be very small, like 1 centimeter, or more wide, like 5 centimeters, 10 centimeters. It will depend of the activity of each patient. It will be related to the diet. It will be related to previous surgeries. It will depend. So Yeah, we don't recommend it on patients with severe reflux or GERD to make a sleeve, because it can be worse, because the pressure inside of your stomach will be higher, because we have sphincters inside that one is the pylorus, is the last sphincter of the stomach, and that increase the inside pressure, and your liquids or your diet that you are having in your stomach go back of your esophagus. So in that case, the best option is to make a bypass, so we can exclude the pylorus or the latest sphincter of the stomach, so your diet or what you eat go through the small pouch and go directly to your small intestine. So there's no restriction over there. So go directly to your gut, and that in that case we can avoid you can have some GERD or reflux.
Okay, so the gallbladder removal, right? If a patient knows they have problems with the gallbladder, and we can have the surgeon removes it at the same time we do the surgery. But
Yeah.
you don't need to remove gallbladder.
Exactly, because only if you know you have some issues, you have gallstones, you have previous pain of the gallbladder, you have an ultrasound that said you have some issues, you have gallstones. That in that case, it's important to planning to remove the gallbladder, because not in all the patients. Approximately is like in the 30% of the patients can have this kind of issues. But if you know you have gallstones, you know you have an ultrasound, you have previous episodes of pain, you can we can remove it in the same time of the bariatric surgery.
Okay, as far as passport requirement, we do highly recommend to get passport book or passport card. So this would eliminate any possibility of getting held up at the border and losing your flight and some other people that you are in the same band with. So we do put a drain for the time you stay in the hospital. That's just another way. If you bleed or if you leak, there is an indication to see if what's happening inside.
Yeah, the drain is I explained to the patients is like a security valve, so we can check what if anything is happening inside. And the other thing is that their drain will help them to take out the gas, and so and then the other thing is that we can check there is a bleeding, a leak, or other thing. To remove the drain, it will take like 10 seconds. We will do it at the bed of the patient. And patients with the sleep will be only less of 24 hours, and patients with RNY or other procedure 48 hours.
Okay, so two things, if you can explain, please. One is, does the surgery help PCOS? And also, what's a period patients need to wait until they get pregnant after surgery?
Okay, of course. The PCOS, if you have some research, is related to the overweight. when you get the bariatric surgery, obviously this will be better for your hormones, and can be more controlled, the PCOS. You can be pregnant more fast if you're having some problems to getting pregnant. We recommend to wait 2 years if you're planning, but some patients, obviously, with this change of hormones, they get pregnant at 1 year, 8 months. But obviously, we recommend 2 years because in this time, your body get under control with all the hormones, the weight loss, and all that related to the obesity or the overweight.
So, okay, so we asked for your health history to make sure you are a good candidate for surgery. One thing that we want to recommend, especially for patients who are getting a revision, is to do just a normal blood test before you come. We don't make it mandatory, but it's a good idea. Let's say if you have had bypass and you do a revision of a bypass, you may be, your hemoglobin is down. So you don't want to get to Mexico and find out. So we recommend you do a blood test as well. But everything else we do, we do EKG, we do all the tests that we need, blood tests down there. But this is for just yourself to know if there's a problem before you come. Okay, so depending on how fast and your genetics, your skin type, your age, and if you exercise or not, you may get loose skin. And if you do have extra skin, you can come back with us. We do have plastic board certified surgeons that can give you tummy tuck, arm lift, breast lift, and so on. Or usually we have these mummy makeover packages that do multiple procedures at one time. Just there's one question I'm trying to ask. Okay, so I think that, okay, maybe you may want to mention something about the band. So if you remove the band, you may not be able to do sleeve or bypass right away. Yeah, you have to check the condition of a band. So can you explain about that? So if they have a band revision to other surgeries, what's the possibility of getting it at the same time?
Okay. Well, first of all, we need to check that the lap bands have no problem. We need to make an endoscopy, check inside the stomach, and then we proceed to do the surgery, the variant wide, mini bypass, or the sleeve. It will depend of the patient. But yeah, the most important here is first of all to check that there's no issues with the lap band, and of course we can do the revision to make the conversion to another procedure. There's no problem.
And so prices for the plastics is different because everyone is customized to their need. Depends on how much skin they have to remove, how many procedures they do at one time. So mummy makeover. So the best thing to do is to submit a health questionnaire with your pictures on MexicoCosmeticCenter.com, MexicoCosmeticCenter.com, and we will get back to you with the exact number that you need to you need to pay. So, and again, our plastics also is all inclusive. So you don't have to worry about a nurse visit after surgery in the hotel. The hotel after, before surgery is all covered. We don't, you know, some surgeons give you price for their surgery itself, for anesthesiologist itself. So, but then it doesn't look high because you don't add everything up, right? We cover anything from A to Z. The only thing you have to do is to get your flight or drive to the location of pickup for San Diego International Airport. So they're asking, is there a better time in a woman's cycle to have the sleeve, or sometimes, you know, depends on their cycle, not to have it?
Obviously, it doesn't affect because women don't control that. So when you schedule your surgery, obviously the stress, the travel, all that can be precipitate your period and all that. So we're going to take good care of you at the OR. So don't worry about the cycle.
That was a good one here. Okay.
Okay, here's another question, that if they can have a healthy pregnancy when they get has my food to absorb nutrients with BSG? Yes, of course. Yeah, you can have a healthy pregnancy. The most important here, obviously, is to have to follow a good nutrition and make some kind of exercise. But the most important is more with the patients with a malabsorptive procedure like the bypass or the duodenal switch. It's very, very important to have control of your vitamins, your minerals, your blood levels, so you can go under pregnancy. Here's some examples of what you can get.
Yeah, the vitamins are a huge factor. And then we do have Emerge Bariatric vitamins that is specifically made for patients after sleeve bypass DS. It comes in 4 different type. You know, you have soft chew, drinkable, capsule, and chewable. So we highly recommend you get on this about 1 or 2 weeks after surgery and take him. For bypass, you probably want to take him indefinitely for DS as well. But these are made specifically for patients who have had bariatrics. And that's huge to take vitamins.
Other patient said here that most common mistake people make that can cause complication after surgery.
Yes.
Obviously, is not follow the instructions or the recommendations we make to them, because when we finish the surgery, you're at your room. At the 2 hours, you're going to be walking. It's part of your recovery, so you feel good after surgery. The same day you are out of the OR, you're going to be walking. So people think that as they feel good, they can do everything. So if you don't follow the diet, you don't follow the instructions that we make, the recommendations, you go out and have lifting, somebody accidentally hit you on your stomach, you go and eat something, all that can be bad for you and have some many complications or some issues after the surgery. So that's the most important here is to follow the recommendations we give to you, and you don't have any problems. Obviously, the rate of complications that we said at when we start is less of 1%. It's like 0.5% of complications, and the most are the bleeding, leaks, wound infections. But if you follow all that, you're not going to have any problems.
Okay, so there is a possibility of leak. There is a short-term leak and a long-term leak. That's why we keep you in the hospital or hotel for so long after your surgery. Those are short-term. So if you're not leaking in the short term, the possibility is almost none, very slim. But also remember, don't lift heavy weight. Don't comply with the post-surgery diet. The post-op diet is huge. You know, you have to go from liquid to solid like in 4 weeks. So these are the things that you need to comply with. If you do have problem though, when you get back, we suggest that you contact your doctor and emergency right away. Don't wait. Of course, you know, sometimes you feel like, oh, this is an emergency. It may not be an emergency, but it's a good idea to be proactive.
Yes, and the most frequently cause of go to ER is the dehydration. That's why the patients after surgery, they need to be with them, their bottle of water, of electrolytes, and drinking all day to keep hydrated. Is very, very important in all the surgeries, bypass, or the mini bypass, the sleeve. You need to be hydrated most the first week. It's like learning again to eat. First days you're going to be the liquids, then you're going to get purees, then soft diet, and then like after the first week you're going to be with normal diet, but obviously less portions. So this is very important to keep on your mind, that you're going to have a life change, a lifestyle change. So you can go through all these procedures.
I'm just going over some of our before after. Remember, we do have two support groups. One is for patients who have actually received the operation, and one that are submitting a health questionnaire, but they're not quite on the calendar. So one is about 10,000 patients. They are, posting their success pictures. They are telling you about how well they're doing. And this support group is huge for patients to get support before and after. You know, we get a lot of couples coming together. As you see, that is really good because you do it together. You are supporting each other, whether it's mom and daughter or sisters or, husband and wife. But we have success stories, thousands of them, that people have changed their lives. For example, Jen, this is a patient that we call them a total transformation. When they get bariatrics and then they come back and do plastics. So she's one of the ones that have performed both surgeries with us and look at the changes they make in their lives. It's not just how you look good and you feel good. It's just, you don't have to take the insulin as much or anymore. You have a high quality of life. You could do things that you couldn't do before. And this is a huge tool that really the industry, the technology, and the skills of the surgeon has made it possible. So at this point, I'm going to focus on getting our winner of our webinar, because we are almost at the end. So our winner is Francisco Franco. Francisco Franco. I'm going to let you talk if you're still there. Hello? Hello? Francisco, are you still there? Do you hear us? Francisco. Okay, well, I guess we can hear Francisco, but you have to unmute. I'm going to give you another chance to talk. Okay. So anyway, you can contact our office today, and you have to actually contact our office today to take advantage of the $2,000 off and arrange your surgery with your coordinator. I appreciate all of you and every one of you attending our monthly webinar. We see you the next time, or we see you in Mexico. Thank you so much, Dr. Montalvo, for your time and attention. I appreciate you. Thank you. Bye-bye.